Hello sir, my name is Zaid Naeem from Group 16. Today my topic is thyroid gland. It is an endocrine gland. It is one of the largest endocrine butterfly-shaped organ. Profoundly influence the normal growth and development of human body. It's essential for mental and physiological development in infancy or childhood. So let me tell development. It develops from the floor of primitive pharynx at the third week of gestation. With thyroglossal, a duct migrates from the floor of tongue to the neck. Thyroid hormone synthesis is occurred in 11th week. Thyroid gland produces some hormones. They are named as thyroxine T4, thyronin T3, reverse tridothyronin R3, RT3. All thyroid hormones are iodine containing amino acids. The other one is T3 is the active form, R3 RT3 is an inactive form. Calcitonin is called calcium lowering hormone. There are some drugs that affects and thyroid functions, such as the drugs such name as dopamine, levodopa, corticosteroids, somatostatin, metformin, bexarotene. It affects it The effect of these drugs are as following: inhibition of TRH or TSH secretion without induction of hypothyroidism or hypothyroidism. The other drugs are iodides including amiodarone, lithium, thyramides, ethionamide. It inhibit it causes the inhibition of thyroid hormone synthesis or release with the induction of hypothyroidism. The other drugs that can cause alternation of thyroid hormone transport in serum total T3 and T4 levels, but usually no modification of FT4 or TSH. The drugs such as estrogen, tamoxifen, heroin, methadone, methatrone that increased TBH. The drugs androgen glucocorticoids causes decreased TBH. The drugs salicylates, mefenamic acid, furosemide causes the displacement of T3 and T4 from TBG and transit hypothyroxemia. Other drugs effect of thyroid function on drug effects, that lower doses of the drug named as anticoagulation drugs, lower doses of warfarin required in hyperthyroidism, high doses in hypothyroidism. The glucose control, increase hepatic glucose production and glucose intolerance in hyperthyroidism, impaired insulin action in and glucose disposal in hypothyroidism. Cardiac drugs, high doses of digoxin required in hyperthyroidism, low doses in hypothyroidism. The management of drugs, the average dosage for an infant of 1 to 6 months of age is 10 to 15 mcg per kg per d, whereas for adults is about 1.7 mcg. Other older adults of age 65 or plus may require less thyroxine for replacement. The drug should be administered on empty stomach. Serum TSH and free thyroxine should be measured. It takes 6 to 8 weeks after starting a given dose of thyroxine to reach steady state levels in bloodstream. Dosage changes should be made slowly. Reduced dosage in older patients. First priority, patient with cardiac disease. Such patients 12.5 to 25 mcg for 2 weeks. Daily dose by 25 mcg for every 2 weeks until thyroid or drug toxicity. Some thyroid drugs: levothyroxine LT4. It can be given as oral or intravenous. Other one is liothyronine T3. It can be given intravenous using myxedema coma. And other pharmacokinetics are is following. The classification of drugs that inhibit hormone synthesis, that are PTU, methimazole, carbimazole. The other that inhibit iodide trapping ionic inhibitors are thyrosinates, nitrates, etc. The third one is inhibit hormone release is iodine, iodides of Na and calcium, organic iodide. The fourth one is that destroy thyroid tissue or radioactive iodine 131, 125, 123. Thank you.